Parkinson's disease is a progressive neurodegenerative disorder that affects movement, balance, and coordination. At its core, Parkinson's disease occurs when certain nerve cells, or neurons, in the brain gradually break down or die. These nerve cells we're talking about are in the substantia nigra part of the brain, which plays a vital role in producing dopamine. Dopamine is a neurotransmitter that facilitates smooth, coordinated muscle movements. When dopamine-producing cells are lost, movement control becomes disrupted, leading to the hallmark symptoms of Parkinson's disease, such as tremors, stiffness, slowness of movement, and balance issues. Parkinson's disease is a condition that develops gradually, often starting with barely noticeable symptoms that worsen over time. Although Parkinson's primarily impacts the motor system, it can also affect non-motor functions such as mood, sleep, and cognitive abilities. So now, how common is Parkinson's disease? Well, Parkinson's disease is relatively common, especially among older adults. It's estimated that about 1% of the population over 60 years old has Parkinson's disease. The risk increases with age, and men are slightly more likely to develop the condition than women. Worldwide, it's believed that more than 10 million people are living with Parkinson's disease. Types of Parkinson's disease. There are several types of Parkinson's disease, each with its own characteristics. Number 1. Idiopathic Parkinson's disease. This is the most common form, accounting for about 85% of cases. The term idiopathic means that the exact cause is unknown. Number 2. Early onset Parkinson's disease. This refers to Parkinson's that develops before the age of 50. Number 3. Familial Parkinson's disease. This type is caused by genetic mutations and tends to run in families. Number 4. Drug-induced Parkinsonism. This type can occur when certain medications interfere with dopamine production in the brain. Antipsychotic medications, for example, can block dopamine receptors and produce symptoms that mimic Parkinson's. Unlike true Parkinson's disease, however, these symptoms usually improve once the medication is discontinued. Number 5. Atypical Parkinsonism. This includes several rare conditions that have symptoms similar to Parkinson's but progress more rapidly and are less responsive to typical Parkinson's treatments. Examples of these conditions include multiple system atrophy and progressive supranuclear palsy. Causes of Parkinson's disease. While the exact trigger for the degeneration of dopamine-producing cells is still not fully understood, researchers believe that a combination of genetic predispositions and environmental factors contributes to the development of the disease. In terms of genetics, most cases of Parkinson's are considered sporadic, meaning they occur in people with no family history of the disease. However, about 10 to 15% of cases are familial, where inherited genetic mutations play a role. Researchers have identified several genes linked to Parkinson's. However, even in people with these genetic mutations, the likelihood of developing Parkinson's is still relatively low, suggesting that other factors are also involved. Other than genetics, age is the biggest risk factor for Parkinson's disease. As people get older, their risk of developing the condition increases. Most people who develop Parkinson's are 60 or older, although it can occur in younger individuals. On the environmental side, exposure to certain toxins has been linked to a higher risk of developing Parkinson's disease. For instance, long-term exposure to pesticides, herbicides, and heavy metals has been associated with a greater likelihood of developing the condition. One widely studied chemical is the pesticide paraquat, which has been shown to increase the risk of Parkinson's in those exposed to it regularly. Additionally, rural living and exposure to well water may also elevate the risk, likely due to higher exposure to agricultural chemicals. Head trauma is another potential risk factor. Studies suggest that people who have experienced severe head injuries may be more likely to develop Parkinson's later in life. While it's not entirely clear how head trauma contributes to the disease, it's believed that it may disrupt normal brain function, making nerve cells more vulnerable to damage. Symptoms of Parkinson's disease. Parkinson's disease has a wide range of symptoms, which can be broken down into motor and non-motor categories. Motor symptoms, which affect movement, are the most recognized aspects of the disease, but non-motor symptoms can significantly impact a person's quality of life. Number 1. Motor symptoms. One of the earliest and most well-known motor symptoms of Parkinson's disease is tremors, which typically begin on one side of the body. These tremors are often described as a rhythmic shaking or twitching in the hands, fingers, or limbs, and they tend to worsen when the person is at rest. Over time, the tremors can become more pronounced and spread to both sides of the body. While tremors are common, not everyone with Parkinson's experiences them. Bradykinesia, or slowness of movement, is another hallmark symptom. It can make everyday activities such as walking, dressing, or writing difficult. People with bradykinesia often describe feeling as if their body is stuck or unable to respond quickly to commands from the brain. This slowness can also affect facial muscles, leading to a condition known as mask-like facial expression, where the person's face appears expressionless or stiff. Muscle rigidity or stiffness is a common symptom that can affect any part of the body. It often leads to discomfort, difficulty moving, and reduced range of motion. In some cases, muscle stiffness can cause the limbs to feel heavy, making it hard to perform tasks that require fine motor skills. This rigidity can also contribute to pain and cramping in the muscles. Postural instability is another common symptom, particularly in the later stages of the disease. People with Parkinson's may experience balance problems, making them more prone to falls. This can result in a shuffling gait or stooped posture. As the disease progresses, some individuals may develop a condition known as freezing, where they feel temporarily stuck in place while trying to walk. Number 2. Non-motor symptoms. Non-motor symptoms can be equally debilitating and often develop before the motor symptoms appear. One of the earliest non-motor signs is a loss of the sense of smell, known as anosmia. While this symptom is often overlooked, it can be an early indicator of Parkinson's disease. Depression and anxiety are also common in people with Parkinson's, likely due to changes in brain chemistry caused by the disease. Cognitive changes, such as difficulty with memory, concentration, and decision-making, can also occur in the later stages of the disease. In some cases, people with Parkinson's may develop dementia. Sleep disturbances are also prevalent in Parkinson's disease. People may experience difficulty falling asleep, staying asleep, or acting out their dreams in a condition called REM sleep behavior disorder. Additionally, fatigue is a common complaint, often related to both the disease itself and the medications used to manage symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Parkinson's disease. Diagnosing Parkinson's disease can be challenging, as there is no specific test for the condition. The diagnosis usually begins with a detailed medical history and neurological examination. The doctor will ask about symptoms, their onset and progression, and any family history of neurological conditions. They will also inquire about exposure to toxins or a history of head injuries. Because the symptoms of Parkinson's disease can resemble those of other neurological conditions, doctors may use imaging tests like magnetic resonance imaging or a dopamine transporter scan to rule out other potential causes. These tests can help differentiate Parkinson's from other forms of Parkinsonism, such as multiple system atrophy or progressive supranuclear palsy. In some cases, a trial of Parkinson's medication may be used as part of the diagnostic process. If the person's symptoms improve significantly with the use of dopaminergic drugs, it can help confirm the diagnosis of Parkinson's disease. Treatment for Parkinson's disease. While there is currently no cure for Parkinson's, there are many treatments available that can help control its symptoms effectively. The most common treatment for Parkinson's disease is medication. Dopaminergic drugs are often prescribed to replenish the brain's depleted dopamine levels, which can help control motor symptoms. One of the most commonly used medications is levodopa, which is converted into dopamine in the brain. Levodopa is often combined with carbidopa to prevent nausea and allow more of the drug to reach the brain. While levodopa is highly effective at controlling symptoms in the early stages of the disease, its effectiveness may diminish over time, and long-term use can lead to side effects, such as involuntary movements known as dyskinesia. To manage this, doctors may adjust the dosage or add other medications, such as dopamine agonists or MAO-B inhibitors, which help increase dopamine levels or prolong its effects. In addition to medication, deep brain stimulation is a surgical treatment option for people with advanced Parkinson's disease who no longer respond well to medication. DBS involves implanting electrodes in specific areas of the brain that control movement. These electrodes are connected to a device that sends electrical impulses to help regulate abnormal brain activity and improve motor function. DBS can help reduce tremors, stiffness, and slowness of movement, but it is not suitable for everyone and does not halt the progression of the disease. Physical therapy, occupational therapy, and speech therapy are also important components of managing Parkinson's disease. Physical therapy can help improve strength, flexibility, and balance, while occupational therapy focuses on adapting daily activities to accommodate the patient's limitations. And finally, speech therapy can be helpful for those who experience difficulty speaking or swallowing, which can occur in the later stages of the disease. At the end, while Parkinson's disease is a chronic condition that progressively worsens over time, many people live with the disease for years and can manage their symptoms effectively with the right treatment plan. Now, we want to hear from you. What advice or insights would you share with someone who is newly diagnosed with Parkinson's disease? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.